Stakeholders Education Plan video. This video presents a plan for stakeholders. My name is Arella. I am a family nurse practitioner from Bell Canyon, California. I also work at our clinic in Port Hueneme, California. I finished my postmaster's FNP at Charles Drew University School of Medicine and Science in Los Angeles, California. My clinical scholarly project is based on elderly patients with dementia manifesting signs of depression and will examine how music intervention compared to the current standards of practice can decrease manifestations of depression within an 8-week period. A brief description of stakeholder groups. The targeted stakeholders include the patient, which will benefit by having a decrease in signs of dementia-related depression, the patient's family, who will benefit if they have less stress and perceived improvement of care, the skilled nursing facility, nursing staff, and healthcare providers will benefit because they will be able to provide better care and unnecessary use of chemical restraints. Regarding sustainability, there would be less cost to the patient and to their family in controlling dementia and depression. Each group's role in the project implementation. The patient will be at a skilled nursing facility and will be given music intervention as part of their therapy. Patient's family will be given support and have less stress. Skilled nursing staff, RNs and LVNs, and healthcare providers, MDs and NPs, will be able to provide better care and unnecessary use of chemical restraints. Elderly patients may experience dementia and show signs of confusion, loss of interest, loss of memories, and have difficulties with everyday tasks, which can lead to depression. One of the most influential forms of art is music and has been around since the beginning of time. Music offers a one-of-a-kind emotional journey that may be interpreted in many ways. There is some evidence that listening to music might improve social interaction and mood among people living with dementia by evoking positive feelings and bringing back fond memories of time spent with loved ones and friends. The clinical problem is that elderly patients with dementia manifesting signs of depression will examine how music intervention compared to the current standards of practice can decrease manifestations of depression within an 8-week period. This research will incorporate screening tools and implement them in assisted living facilities and incorporate them as a part of cognitive therapy. As part of admission and intake, individuals will be asked about their favorite song to elicit the happy memories and will play them routinely, and incorporating music intervention as part of the program. Identify educational needs for each group. The nursing staff and office staff will be educated on depression and dementia and identifying and recording signs and symptoms in the facility and in the office setting. The providers will be using screening tools and implementing them in assisted living facilities and incorporate them as part of cognitive therapy. As part of the admission intake, individuals will be asked about their favorite songs and memories, and they will be played routinely, and incorporating music intervention as part of their daily program. Outline a plan for delivering the intervention. An advanced practice registered nurse can use music intervention in a clinical setting, such as a skilled nursing facility or elderly facility. The patients and their families can expect that music intervention will lessen the signs of depression and apathy in elderly patients who have dementia. In some studies, their results showed that there was improvement in efficacy of receptive music intervention on ameliorating apathy and depression in the elderly who have Alzheimer's dementia and decreasing the burden of caregivers. In patients with dementia, there were a lowering of signs of delusions, irritability, hallucinations, moderate dementia, and agitation that could be attributed attributed to the higher intensity of symptoms due to the stressful environmental conditions. Music is a positive stimulus and can bring about emotions that are positive in an individual. It affects both the endocrine and autonomic nervous systems, and there is a lowering of stress-related activation of the adenomedullary and parasympathetic nervous systems. The risks were found regarding cognitive function. In a study, there were no differences statistically in the MMSE in both groups studied. Massai et al. Also mentioned that there was one limitation in their study design that they didn't correlate each cognitive function in relation with music intervention when there was evidence recognition of the emotions associated with music was identified in subjects who had Alzheimer's disease or Alzheimer's dementia. In elderly patients with Alzheimer's dementia, music enhances the encoding of information that is verbal. Massai et al. Discussed how music can change the executive, auditory, and associative networks that are involved in learning and brain plasticity. Results in this study show that music intervention in elderly people with dementia with at least 5 sessions may reduce depressive symptoms, but has little or no effect on aggression and agitation. Cognitive function and signs and symptoms of depression are improved with the assistance of music intervention in elderly individuals. Many music interventions can choose between group or individual music therapy. There are many types of music interventions that can be applied to a research study. Music-based interventions can be separated into categories such as active or passive. Active music therapy is used by a therapist, and individuals are able to dance, sing, and play music as therapy. On the other hand, passive music therapy is when individuals listen to music primarily. So the project is going to use passive music therapy. An advanced practice nurse can also use music intervention in a clinical setting, such as a skilled nursing facility or elderly facility. The patients and families expect that that music intervention will lessen the signs of depression and apathy in the elderly patients who have dementia. In the study, the results showed that there was an improvement in efficacy of receptive music interventions on ameliorating apathy and depression in the elderly individuals who have Alzheimer's dementia and decreasing the burden of caregivers. A clinical provider will be able to use these findings in this study to apply in clinical practice and also in the skilled nursing facility. Thank you. Bye-bye.